So it's very simple in terms of, I think it's a very good case. Okay, if I have to choose to start with, I'll start with something first. I'll probably add a little bit of filler in this area because you can see the nasal labial fat pad is there. There's a bit of lack of volume. But volume is not the major thing here. The major thing is this. The volume is displaced medially, there's some skin laxity. So ideally, the areas that need to be treated, jawline. But see, when I pull it, still have a little bit, the pre-jaw is not totally corrected. So this is an area usually you need to add volume. So definitely will improve this. But if I just do this, it's much less if I do this. This is the best result. So that's why I usually use 2 threads. Okay? And then you need to also to go on the mid face. Can you see yourself on the mirror? This is what we're intending to do. You'll be happy with this?
Yeah.
Okay. Can also help a little bit of a brow lift. But,
no, I don't want to.
But that's the thing.
Because
brow lifts are...
too many at the time.
Yes. And the brow lift, the thing is, I'm just going to mark just to show,
Yeah,
okay?
yes.
So that's how usually I mark. So first thing I start from down, and you can get your fingers really under the jawline. Can you get, and you get the posterior one here, and you see the angle is there. Because if you just aim for the angle there, you're out. It's here. Okay, so you have to get one finger, and you feel it is, okay? So this is the entry point. It's the only place, the only 2 places where I define the entry point before the exit points are neck, jawline, and brow. Okay, because they are stable entry points. From here, okay, this ruler, the 0 is there. Oh, they got, probably going to get this. Forget about this. Huh? This is not true. So just get just the scale. So I got 1, and I got 6 centimeters. See when it finish there. So if I've got the last cone, probably will be here. And that's what I want to track. And if you get the ruler here, and you do this movement, see how it goes? And you end up with the 5 centimeter is here. Okay? So that's why I mark 6. Because if I mark 5, I'm going to end up with like 1 cone less. This will go out. And from this point, I mark up another 6 centimeters, and there's the point. And this will be my first jawline thread. Okay? Some people like to mark it a bit posterior. So, but this is where it needs to be. And if you place it a bit higher, when you tight, this line becomes straight. You lose the angle, because this is where you got the retaining ligaments. Okay, then the second, this is clear, right? Yes. There's not much of a difficulty.
Excuse me. So you don't want to be a little more posterior to that? You were saying something about
because there'll be no retaining ligaments there.
So it won't be a good anchorage?
The angle is when you get your fingers, there's the angle. That's where you need to be. Okay? There's a bit of a marionette line. And there's the jowl. So if you want to treat the marionette line, you place there, and you go like this. But I want to take this jowl. So I am going to make the exit point a little bit more on the jowl, because this is what I want to pull. So from this point again, I mark 5 centimeters, not 6. Why? Because if I mark 6, I'm going to end up there, and it'll be too far away. And I need to get this one. So 5 centimeters, I got 5 centimeters there, so this will be the other exit point. And now is a matter of deciding, I pull it backwards or I pull it upwards. So just see where it moves. This moves up. Backward doesn't move as much. And if you get the ruler like this, just see how it displays, and you want to bring it up there. And that's 5.5 centimeters. Why 5.5 and not 5? Because I got more movement there than here. Okay? I want to make sure that I'm going to absorb all the cones in. And that will be my second point of exit. And this will be my suture. And this will work with the marionette also. Then I need the mid face. if I do the mid-face, see, these two, even the marionette line goes. And some people have marionette line, it's just because of the fold, it's not a volume problem. Actually, if you had volume, you're going to be very, very chubby there. So what I do is I mark the other point, and usually if I do two sutures for the nasolabial, I put one there, one here. If I get just one, I just target the middle. Okay? Okay? So the same thing, I got 5 centimeters, and this has to be a bit more horizontal, because otherwise I will end up there. So this is where I want to bring it back, not up. I will bring up from here. So 5 centimeters, I end up here. And from this point, I have to decide if I go there or if I go up. And I want to go up. And I want to go up, and I want to go up like this. 6. 5.56 is usually a good measure. If you do measure longer, there's no problem. If you measure shorter, then you have a problem. Okay? And this will be, actually be here, the point, and then with an angle goes there. Okay? You can see there's a bit of a swelling, like a small festoon here. So I want to at least to get like 2 centimeters from the lateral canthus. This is the orbital rim. This is what I want to be. And then I just take some measurements just to make sure that then for the other side. So from the lateral canthus, I got 3 centimeters. For this one, I got 5. And from this one to this one, I got 3.5. Okay? So let's do the same thing on the other side. So again, it's the same thing. Jawline, define the angle. There is the angle. I mark it. And I don't mark it on the edge, because otherwise it goes there. You have to mark it over the jaw. From this point, you mark 6 centimeters, which is over there. Another 6 up here. And this is your thread. And I want to go above, because that's where the jowl is. Some people target here, and that will pull it like this. But you lose, if I do this, I lose definition on the jawline. See, this becomes, and I think jawlines are created by this. Okay? So this is a bit more horizontal, is a bit too up there. Then you got the jowl that it's here. And here, can I just make like this? I'm going to move your head a little bit. If you get dizzy, let me know, okay? I just draw the midline. And from this point, I want just to make sure I got it correct. So this is the 0. I got 3 centimeters. I got a little bit more. So where is, sometimes my midline is not in the right place. Yes, it's in the right place. There you got 3.5. And I got 3.5. Okay? Because sometimes one side is not, they're not exactly the same. But we know that. And from this point, which is the second one, I got the 0 here. I got 5.5. And that's what I want to get it, 5.5 there. Trying to be as symmetrical as possible. The same thing, 5 centimeters up. I got 0 there. And from here, 5.5 to 6, which ends up there. This is a straight line. And then the nasolabial folds, just go there. And again, you need to see where it moves, because you got more movement up there, so that's what I want. And actually, the left side is a bit more pronounced than the right side. So when you're doing this, actually you are assessing the symmetry. This is the first thing I do with any patient is looking for asymmetries. When I'm talking with them, because most of the times they have no idea. And even when I'm doing breast surgery, the first thing I ask is which one is bigger. Most of the people don't know. And again, you need to move up, and we'll be up there. And I think I'm going to need some corrections on these markings, because they are a bit different from the other side. Okay? And that's where you start measuring. So you got 3.5 from here. So always choose something that is stable. Can you open your eyes? Can you open? Thank you. I'm not going to get anything on your eyes. And I got 3.5. I got 3. This has to be a little bit lower. This is there because I was running out of room here, see? And I think this is the problem. So this one goes there. This one goes a bit more horizontal. And from this point to this one, I got 2 centimeters. Here, I got 1. So I need to go there. And this is my point, is here, not over there. So this is the vector. And I'm going to check if it is true or not. Okay? It's not going up, it's going backwards.
So I've got a question, doctor. See, there is an existing asymmetry most of the times in people's faces. So would you be so rigorous in measuring accurately between the two sides, or would you go customize the measurement according to the asymmetry?
I try to make the insertion of the threads as symmetrical as possible. Then the tightening will be asymmetrical.
All right.
Because you can work in 2 ways.
All right.
And if you standardize from the beginning, you are more able to correct that symmetry than adding a different asymmetry.
So the anchoring thing has to be measured, and the lifting is what is varied.
Yes.
All right.
And the other thing is, you need to make, because I was getting these too close to each other. Yes. And too close, they'll be competing, because they're different vectors. If they're the same vector, there's no problem. But if they have a slight direction, different of direction, they'll be competing with each other. And then this one goes, oh, thank you very much. Then this one goes up. Okay, and it looks nicer there. And they get 3 centimeters, and I got the same thing on this side. And these I'm not very particular there, but 3.5. This is a bit too low. If you compare, I like this side more.
Yes.
Okay? So I always do this, because once you go from one side to the other, you do simple things. And if you are right-handed, you see things on the right side different from the left-hand side. Okay? So this way you need to move around and see a bit of expression. So this is what I'm going to do. So we're going to do local anesthesia on all these points and get the threads in. This is where we take time. The other one has to be faster. Can you bring the head down a little bit, please? I just need to correct this one here. And this is going actually there. It's okay. This has to go more here and there. This is the point, a bit higher, okay? Because I want to bring this up a little bit more. I like to work from the upper part, and that's also for showing you. I have to work from above, otherwise my hands will be in front of you, you don't see anything. Okay. This is the only thing you're going to feel. I'm going to do it very slowly, okay?
I have a question.
Go ahead.
Now you're going to prick it, right? Now this jaw bone is there.
I'm away from it.
Is it going to hurt me that night?
No, I'm not even getting to your bones, okay?
No,
I'm
just
being
thought
very...
It'll pain a lot.
No, this is not like the dentist, okay? Going to feel a very small prick is this one, like this. That's it, okay?
Slightly tumescent?
Just
So
a
that
small
you just
papule,
lift
just a small
small
papule,
papule.
okay? Yeah, this has, I like to do this with adrenaline.
In the first few cases, should we keep about 2 hours per case, just so that we're relaxed?
I think it's about how much comfort you will be. Just make time it.
At least an hour, because this assessment takes time. We
Okay.
shouldn't hurry it.
Usually when I have a Silhouette soft planned, I book 1 hour with the patient. Okay. Just have a deep breath, okay? This is the only thing you're going to feel.
My mouth is quite dry.
Okay? This is where you should inject slowly.
Yeah, painful. There often is a vessel out here, which is the mandibular branch of the facial artery. Can you just tell us about the facial artery and the mandibular branch of the
Yeah,
facial
I
artery
can.
in terms of avoiding
That's the last one here.
inadvertent piercing?
Yeah, I will.
Because we always think like that for fillers, so I just was wondering how
Okay,
much.
let me just do the anesthesia, and I'm going to do some drawings. Okay? I'm going to do something slightly different on the other side, will be more comfortable for you, okay? Done. Okay? Now we wait. The facial artery asks the patient to clench. You feel the anterior border masseter, and that's where it comes. But arteries are very easy, they have a pulse.
Exactly.
So you feel it. So, and then the artery goes straight to the nose, okay, and it goes up. The thing is, here usually you have two branches for the lip, another one for the nose, and then the dorsal artery of the nose goes from the supratrochlear artery there. The anastomosis between this one and this one, 30% doesn't exist. So in 30% of the cases, the lateral artery of the nose becomes a terminal artery. That's where the complications come from. Okay? The marginal mandibular nerve is a bit different, and it goes under the parotid until here, and here becomes more superficial. But it's always deeper to the platysma. And then in like 27% of the cases, it goes like 1 centimeter below the mandible. This is 27%. So what happened to the other ones? It can go on top of the mandible, it can go above the mandible. That's always under the platysma. And sometimes it has a bigger loop. And it just goes up to the mentalis a little bit in front of the prejowl, okay? But it goes deep, and he approaches the muscle, the mentalis. It's the only muscle that is approached from the surface, not from the depth, because the other muscles are approached from the depth, under the muscle to the top. That's why with the focus ultrasound, with IFU, sometimes have a problem here, we avoid it, because it's more superficial. The problem is not that, is the nerve, the facial nerve is very sensitive to heat. When we are doing the parotid surgery, sometimes we pull it, do really bad things to the nerve and nothing happens. Sometimes we don't even touch it. And just using some cautery and you get a transient paralysis after the surgery. Okay, so it's it has some personality, you know? That's what I told her. So the thing is, when you do this, you stay there, but you stay superficial to the nerve. Okay, you never go there. Never. And if you are doing Kaitera, I think it's more dangerous than IFU, than threads, or than fillers. Why? Because the oxyculate is not specific for fat. It is a detergent of cell membranes. It destroys cell membranes. So you have to really stay away from it. That's why we inject it and we have to bring it down. We don't bring very close to the jawline. Okay, I'm going to ask if you can just turn your head to that side. This is just to clean. I'm not just to clean. Okay, just cleaning.
But do you tell your patients to wash their hair and come on the day of the procedure because you're entering from the?
Usually not, because I don't trust them.
Because a lot of women use product in their hair.
Yeah. So what I do, I clean it myself. And I ask them to remove the jewelry, and I'm very considerate about the back part of the ear, because there's always some stuff that accumulates there. There are two areas of the body that tend to accumulate. Everything is post-auricular area and the belly button. Okay? You're getting a nice tan now.
No, now you won't feel any.
The worst is over. Worst is over.
Okay? You're going to feel me touching you, but that's all. Okay. Now just get a sterile drape, like a hole. Okay. I'm going to ask you something. Can you come close to me, please? All of you. Thank you. Perfect. And you get the area that you want to treat. And there's some saline, right? Usually I do this. Sometimes you can think this is too much. It is never too much.
I do the same for cannula.
Never too much.
Absolutely.
Okay? And if the patient is with a bit more of anxiety, what I do is simple. I'm going to get some wet gauze over your eyes, okay? Just to relax. Like this. Okay? Is comfortable? Perfect. Good.
And then
And this is what you need to do, because those knots are not tight, see? So you just get your fingers close to the knots and tighten them.
Oh my God, you're giving so much of traction. We'll break them.
Slowly, right?
No, slowly, slowly. But don't do like this, otherwise you'll break it, okay? Just
Hold it close and
close and that. This is
we
the,
need to refrigerate these.
oh, it has to be kept on the fridge. Otherwise, you probably
That's
like,
why you said you're not to pre-tighten them because they may break.
Did you
yes.
stretch it?
Okay, now let's do the first thread.
Yes.
Do you feel anything here?
It's temperature.
Do you feel anything? You feel a prick? What about here?
No, no. Are
Is
you
it a
pricking?
pressure? No, he's not.
No,
You feel a little pressure, not pain.
Do you feel anything? Okay, so the thing is you stretch, pinch, and prick. Okay?
You always work on the top first.
And that's the beauty of the adrenaline and the beauty of waiting.
It's also safe zone.
Yes.
It's also very safe zone.
So then again, what you do is this. You stretch. See, there's a 5 millimeter.
Yes.
And then you just put the tip in. Okay? Then you pinch and then you go vertical. Okay? See? It stays, doesn't fall. And then you move with a pinch.
So do you go caudally first always?
Okay, okay, okay. No, I can go caudally. It's up to you.
Okay.
Okay, and I'm there on the exit point.
Do you
Actually,
start superiorly with the threads always?
No.
Or no.
No.
No such thing. Once you've marked it, doesn't make a difference.
yes. And then just,
I think, sir.
okay, it's gone. Okay, the
No.
pain. It's numb because what you feel is one another
It's
place.
almost over.
Okay,
Okay.
No,
So it's just halfway down the course.
okay, and you keep halfway.
Be careful that the others don't move.
Okay,
Or you
And-
can cut them
and you cut it.
and you release that.
Okay, you don't need it. Just
If
put
you're
it there.
not sure, should you leave the needle for some
Yes.
time
Yes.
Yes.
before you cut?
The thing is, because you can pull it back,
Yes.
Exactly.
it's not. You cannot
It's
pull
not
it back.
easy.
It's not easy.
No, I'm
That's the
sure.
painful part. Huh?
The idea is not to
Okay, so to go to the other side, no, it's okay. I just go from here. You do the same thing. So you stretch, but the needle has to go always vertical. If you go oblique, it's wrong. So you get there, vertical, stretch, the tip is there, pinch, okay?
Yes.
The black mark is 5 millimeters. 5 millimeters up there is too much, up here is too less. And then you just do this. See? You got to remember, this is convex, so you have to raise your hand as you go around the curve. And if you see that's a bit of entanglement, just come out a little bit.
She
Okay?
doesn't have much fibrosis.
No, this one just goes out like this. To get the thread in, just this. See, this hand I'm not doing nothing special,
Teasing.
just getting some tension, and this goes
So you're not supposed to pull that. Little bit.
a little bit. Okay?
Great.
That's it, done.
She's a very good case, actually.
Okay? It's not a complicated treatment. So let's get another thread. We can open, I need 6, so you have to,
This is the same. This was the 4 and 4.
yes.
And so what I've seen is you need delicacy
Yeah.
and finesse. You need a lot of just delicate
Just
movements
control
and
your hands,
firm,
yes.
firm, delicate movements.
Speed comes from being on the right place. If you go too deep, it's more difficult to go. If you go too superficial, it's more difficult to progress.
The easiest, the plane of least resistance is the right plane.
There's always a bit of pain here on this one. Why? Because you are getting on the reflection of the fascia. As simple as that. Okay?
So if you want to make our patient comfortable and not have them abandon, would this be the first, which is a good first placement for a first-time patient? They're going to get pain at any point?
This one.
This one, right?
This one is the easiest of all them.
To start here.
Okay.
Yeah.
Getting these vehicles.
Okay. So stretch, you pinch, prick. Don't need to go very deep. Just make room for it.
Two exit points.
Okay. Entry, stretch, No, I need the needle again. When you open the hole, make sure you just go because otherwise it closes.
And first you mark the exit point up. Then you mark the exit point and then take the middle. Exactly.
Okay.
Not the 10 and then divide it. Okay. It's not it.
So vertical, you get in, pinch, prick, and this stays. Move it up, and this is my exit point. Pinch. Just make sure you're in the right place.
I'm much more comfortable in this plane. It's a quiet plane.
The moment you go down, it's easier.
It's quieter plane, yeah.
So if you are starting from down, because you're giving more comfort to the patient. And start on the right side.
Why is that?
Because
you're righty. That's
no, this is one, and the other one is the left side is always more painful.
which is
Is it?
that's a revelation.
Try on your patient. They always complain more on the left side than on the right.
If they're right-handed, or is it related to the dominant
But
side?
I don't know why
You
it is.
don't know. Okay, I'll
But
try
it's,
to zoom.
but try observing that.
Yes.
Okay, now you go down.
Yes.
Yeah.
The fillers, always,
Maybe I'm thinking about my pillow.
when I'm doing demonstration, I always start on the right side.
Okay. Good point.
Can you move a little bit like this? Thank you. Perfect.
Just move your head a little bit.
It's perfect. It's perfect. You just stretch, pinch, and when you pinch, because I have two holes here actually, you have just to make on the right one is there. It just goes. You don't need to press much. Okay? So just stretch, goes in, and that's the exit point. See? This is the guiding hand. Deep breaths, 1, 2, 3. Why is painfully? You got some retaining ligaments there. And I'm close to the exit point. Can I have the cap? That's it. And see how it goes. See how it goes so well. You're not doing much of a strength there. That's it. Okay.
So milk it at the opening and pull it
Yes.
on the other side. So that milking action will
Okay. No. If you pull, I'm going to have a break. Okay.
What about needle? Has that ever broken for you?
No.
Francisco, I really need to shoot one of these.
Okay. Shoot it then, but don't shoot me. Feel anything? What about now? Okay. The skin just a bit more thick here.
Yes.
So you have to open a bigger hole. Yeah.
There's two little bumps out there. Are those cones over there?
Now this is from the passage of the
You won't
thread.
be worried because she's
No,
got some
not at all.
atrophy there.
Oh, in the middle
Not
of
at all.
those two.
Not at all. Okay.
Not at all. Because that we're going to tighten it and we're going to redrape it.
Okay. You
Okay.
drape the skin.
And
over it.
remember, once you place the cones inside, you're going to create irregularities. Because there's something in there. This is the opposite of fillers. Okay. Stretch. Let's look for the entry point. It's here.
You have inserted and
Prick.
you have forgotten to stretch the knots. What do you
When you tie it, you're going to have not the full, you might have a break of the suture.
But why would you put that?
Because
Yes, you never know what step it
so
is,
the best
step
thing
you
is
forget.
train your nurses. They give it already tight.
Oh, acha, before putting it.
Ah.
Correct, you're right.
Okay. Breathe. No. Yes. Breathe. Okay. There we are. And if you want to make sure they're on the right plane, before you take the needle out, do this.
That's what you were telling us.
Okay. See?
So you take the full length of the needle.
Yeah, because you can come back. There's no thread inside. Okay. You're in the right place.
You're right, this is not painful.
This is goes like this.
So instead of taking the whole thread out, you better check with the needle.
Yes. Thank you very much. Okay, and now you go. No, what you have to remember is this.
Once you do your first 10
Stretch,
pieces, it will be
go
a fine
vertical,
level.
get the tip in, just a tip, pinch, you feel a give. Move oblique, Get the pinch. Move. Up. Get the pinch. Move. Get the pinch and move. And you can actually do this if you want. Pinch and move. And move. There we are. You bring this one out. That's it. Okay, and keep it the needle inside the cap, so pull it and you, sorry?
If you puncture the vessel while doing it.
Yeah. Yeah.
Pressure.
Then you do it. That's it.
No, while putting the needle, if you puncture any vessel.
Ah, it bleeds.
What to do?
Press.
Just that.
Press. And the thing is, it's going to drain by this and by this one.
No, so we take out the needle?
No.
No.
No, if you can take the needle and press, because the thing is, if it's just the needle,
Yeah.
take it out and press.
Yeah, so
If it bleeds on the entry point, press. Okay?
And
And
you
if it
pause
doesn't-
the procedure then, or do you continue with
No,
it
I
after
press it.
a few
I
cases?
can ask my assistant to keep the pressure there and move to the other one. Okay?
Have you ever had a hematoma?
No. I have a bruise sometimes.
No hematoma.
No hematoma. I treat a lot of Caucasians, and they do bruise easily. Okay? This side is done. Okay? Let's go to the other side. You guys turn your head like this, a bit more. Okay, let's get some betadine on this side. The thing is, the thicker the skin, the more. I didn't do much anesthesia. I don't like to do much. I just like to do on the entry points, not on the. A little bit of anxiety associated with this procedure, and there's the waiting, and a lot of people, and my concentration is a bit diluted with everything. So that makes the patient a bit more
Could
anxious.
we tell the patient to take an anxiolytic like?
Treat them as you do. Treat them as you're doing fillers.
That's nothing.
Huh?
Okay. Fine.
Fillers are more painful. Botox is more painful.
Botox is the most.
Okay. I need another pack.
Can you apply betadine while you are doing other side on the other
Yes.
side? It takes long time for betadine.
You can. I just don't know. Betadine is immediate. I just want to make sure that I don't erase my marks. That's why I apply betadine, because if I ask someone else is not so concerned about the marks, when I get here, there's nothing. So we have to start everything again. Okay. Yeah. Comfortable? Good.
It's like the United Airlines
Which is?
Stretch.
after that.
Touch it. Break it. Okay. You have the thread? Oh, thank you. It's stretched? Not yet? So, stretch it. And I'm going to ask you, can hold this one for you, because I don't want to. And the thing is, at the beginning, start to get some sterile ground, because this will be going everywhere. Okay, and I always, when I do this side, I put it up there. So stretch, tip in, bring. There it is. Okay. See? There we are. Don't come out on the other side of the fold. Come out lateral to the fold, because if you put a cone in the fold, you are pulling the fold backwards, so you get to get a more deeper fold. The same thing goes to the marionette line.
That's opposite to the filler. You always medial and medial right? You have to stay.
See? Not much of a difficult to get in. Okay, let me try doing this my left hand. So again, you stretch, stretch, get the tip in, the tip goes in, brink, and you go up. Okay? Okay, you're going to feel a little bit here, that's it, and you go faster, so you can cross that point.
It's very big.
That's okay. Okay, 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 okay. That's it. Sometimes when you get here, you lose the tip of the needle because you cannot feel it. So what you do is get another one, because you cannot take it out, you don't know where you are. And measure it. See? There's where I am. So if I pull it more, I'm going to end up there. I don't know where I am. Because once you get to the scalp, it's very thick and it does move as well. And sometimes it's difficult to take it out. So you have to get the cap really under the needle. Okay, and try to raise the needle a little bit. And there it is.
Yep.
And keep it inside the cap so you can get out of the airline and you're not pulling any hairs. Because sometimes the hair pull is worse than what you're doing. Okay, see? There it is. Okay, let's get another one.
This is just the placement stage. Actual adjustment is
Do you feel anything there?
That's going to be crucial too. Because of the asymmetry.
Okay. Just make sure you're on the right. Tight? Yeah, it's good. See? No, this is not tight yet. You have to make on both. Okay? Good. So, the threads, it takes more than 2 years. And you prick. But the result doesn't take the same, huh? It's like AJs. AJ stays longer than the result. That's all. Every time I got a new guy coming with a new AJ saying, oh, this has long results, it lasts a long time. I ask him, what's the last long time, the results or the filler? And then they are a little bit upset. And I do use a lot of AJ. Okay, that just have to be careful not to get the hair inside. It's okay, it's done, it's okay. She trusts me. Okay, there it is. And sometimes you feel that sometimes it's not going well. Just do it a bit more of a, and that's it. Now we go to the other side.
Are you okay? Yeah, I know. Second round of anesthesia.
And also knowing what you're going to do also. Okay, and then you move, wait.
So suppose if we don't enter from the same hole and if in case...
You have to go from the same hole. You have to make sure you go from the same hole.
No, what I'm saying is, so if there is a loop, suppose, is there any chance we could just cut the loop and the edges?
That's what he said. You lose that traction,
but there will be some, it's better than having a loop outside, right?
No, make sure you go in the same hole.
Yeah.
just make sure.
If you don't have that sure,
No,
make a new one.
Compromise. In your mind, don't compromise. In your mind, just make sure you go. You should be like...
Okay.
No, it's very easy. Just press it, like a cannula. You press it and squeeze it, the blood drop comes, just going straight.
Blood is very helpful.
Blood that comes, no, I'll tell you that's the way.
And the thing is, that's why you should do the anesthesia. I didn't tell that. I don't do the anesthesia exactly on the point. I go from the side of the point, so I don't have another hole there, so I can get messed up. That I did forget to tell you. It's, sometimes I never realize I have to tell that.
What?
When I go to anesthesia, I don't go there straight. I go from the side, so I get my anesthesia point is there, not on there. So I don't confused. That's it. This is the first thing.
Back where we are discussing
No, keep that one. I'm going to that 16 hole. Let's use a 16. Okay.
Make it bigger.
Yeah, just just at the beginning, make a bigger hole. Okay. Just. It's okay.
The last one.
It's okay. I'm going to show you what happens if you get a too bigger suture in there. Okay. So this is a 16 cone. So you tight it.
Oh, you've got 16 now.
Okay. Because we open it, so let's take that as an example.
Okay.
Can I give you this? Just to hold, please. Thank you. So you do everything is the same. Pinch, superficial, superficial. You make sure in the right, this is where I want to come out, right over there. Okay, that's it. They go in the same way, but see, there's one is outside still and already not able. So what happens is I have to bring it out.
One or two.
Okay?
And sacrifice them.
Now sacrifice them. You cut the needle there. But
Rather than sacrificing the whole thread.
yes. But then you have to make sure you cut the knots, so don't leave any knot on the under the skin.
If by chance there is any unsterility of the thread, can they be put in Sidex solution or something? Because
Destroys it.
will melt off.
And the thing is, you get Sidex, you have to wash it very, very. Sidex is very toxic,
Corrosive, yeah.
and you cannot make sure that everything is. Throw it out. And assume the cost. That's the only way of doing it. Okay. The last one, okay?
3 exit points, 3.
That's it. Okay. We still have a little bit of light. It is going to.
Finished, you're done, you're done.
Let me just do this, because the other problem of taking too many cones is a bit painful when you take them out.
More anesthesia because when you're pulling out the cone.
Okay. So far was it not a very complicated thing. Okay.
Suppose you were to put in a biostimulating filler, when would you put it, after this or before?
Before. See, this is a bit longer. I got all of them inside because I came out a little bit. That was always a bit painful. I just went up a little bit higher so I can keep a bit more of cones here. Because there's another option. Just make the. Here I cannot bring it here.
Yes.
Here I can. Okay.
Plus this is her worst side, so no harm in
Yeah.
having a few extra
Okay.
cones.
Good. We can cut this one out. How are you? Everything is inside. No need to worry about now. Okay. So what we do now, we are going to sit the patient. We're going to, and we give some break to the patient. We're going to clean the face. This is usually where I give some time, so she can breathe,
Take a deep breath.
finish the meditation. This lady has a very good indication for fillers on the temples. That would be probably what I'll start with. Temples, I think, is the forget area. Now everybody's focused fillers on the jawline and chin, and I do think that temples is what you forget more. And from here, we can actually see everything. Please.
And we should tell the patient not to, any restrictions with exercise?
Yes, I tell them not to lift weights. Don't, it's okay. I bring it. And if you have too many, you can put like a mosquito to hold of them in place so it doesn't annoy the patient. Okay, and here is where I start. From up. Okay? I start from stretch, from up one. You're going to hear some noises, okay? That's all. And you pull it. And you actually move the tissues against the cones. And then I just, even with this, just I bring it to the other area of that one, and I can fix some irregularities, okay? And there's a moment it doesn't move more. I leave it. And I go to the other one, and see the difference?
Amazing.
Okay? Not much of a dimpling. So now I have to go for the other one, and this is the vertical one. See how the rippling is coming quite fast there? So you don't stop here, just get your hands there and you start, because you are moving also the distal cones. Okay? And then you bring this one and you bring it up. Sometimes there's a bit of a small, see this is, in this area is very common. Just press it, release it. We don't need to overcorrect. Okay? Release it. And then you come again and try to reposition it. Okay? And then go on the upper one again because I can get more excursion there, and that I move these ones down. See, it goes up. Then the same thing on the jawline. Here, that's the reason why I give the anesthesia. See, there they are out. It's always, I got 3 out, so I get an extra 1 inside, because there are 5 cones inside. And the same thing here, I'm going to take another one probably out. Nope. And you don't want to end up like this. Okay, so make sure it's tight but not over tight. Okay, and I can correct this. Before I cut, I go to the other side and do the same. The problem of having 2 sides is you have to do it. Again, the same thing. Start from up and then move your hands.
Oh no.
Okay, there it is. And then you get this one.
How do you ensure you're symmetrical?
You feel the tension, and then I'm going to check it before I cut everything.
Okay.
Okay. Then you got this one. And bring this one up. There's always a bit of puckering because we are moving it. And then you go again. See, this was, I went up a little bit too short. There's a knot there. Okay. And then this one, because when you get everything tight, something will change. And sometimes this one doesn't move much because already when we insert the cone, already you got the movement in. So there's not much of a movement there. Then you're just going back to the first one, see? Because I already tied the other ones, I release some of the pressure, so it moves better. And the same thing here. Because I want to get there. Okay?
So the end point is when it doesn't move anymore, when you can't pull it anymore.
No, you can pull it, but you want to get smooth, and you get the result. Can you see it from there? Sorry? Oh yes, you can break. That's why you have to make a counter pressure. It's not the pulling, it's moving the tissues over it. Because I move them down, and the cones will bring up everything up. Okay, let me have a look at you. I need a little bit more there. Okay, right here. So what I do is, again, I just going from up, down, and a little bit more here. Just keep it with attention. The same thing here on this side. That was a bit more over it. And here is the one I don't like as much, because I might have a cone coming here. So what I do is, I'm going to release it. Can I have the back of one of the needles? Yes. So instead of throwing them out, at least keep one. See, that's the mark, that's the sharp end, this is the blunt. I'll go there, and I get on the hole, and I'm going to release it.
Sufficient time.
Yeah. Not much of a, because but do this with the blunt one, see? Improves. And this the next 2 days goes away.
Just teasing it.
And then scissor, and make sure you do this. See, there's one cone getting up there. I want to take that one out.
So you should not end at a knot.
No.
Okay.
Okay, take them out. And now, because I pull it, there's a bit of puckering, and just release it. But this is how it should end. Nothing comes out. The knots and the cones are inside. Okay? Just make sure you pull it down. It's like the PDLs here, so you don't have anything coming out. Without cutting any hair or trying to. What I tell the patient to do at home. First week, don't do heavy exercise. Don't lift weights. When you do something around the mouth, make sure, don't big bites. So we have small pieces of food. Don't need to be soft food, but don't open your mouth very wide. Because what they're going to feel is it's quite tense. They're going to feel some tension, right? Do you feel some tension on your face? That's what the sensation is. No facials, no heavy massages. keep your normal creams, but do it in a soft way.
14 days is no
2 weeks,
facials
yeah.
and the
Facials at least a month.
month. Sauna, steam.
First week.
First week. And yoga also, no yoga, deep breathing.
No, you can. That you can do. That you can do. But the only thing is being with the head down for a long time. And
Swimming?
swimming, it's okay.
Okay.
Yeah.
Maybe a week?
But it's okay. This is closed. Everything is closed by tomorrow, so there's no
Yeah, the
contamination.
hospital down.
No antibiotics. I do tell them, but I tell that to everyone. High doses vitamin C, like 2 or 3 grams a day. And steroid strips.
NSAIDs in case they call
Thank you.
complaining of pain. Just paracetamol?
Paracetamol, no, I usually give them ibuprofen.
You do?
Yes. If they do like 3 threads, they might have some tenderness on this point.
Mm.
For the first night, they might have a bit of swelling in the night. It's a bit uncomfortable. The same thing with fillers. Take anti-inflammatory just before going to bed. That's it. And you can sleep with your bed up a little bit, your head up a little bit. The thing is, you know how to fall asleep. You don't know how you're going to wake up. So try to, and but that's it.
And do you also recommend that they, sorry, forgot, arnica? Arnica tablets, arnica
If you do
gel?
that, start 5 days
5
before.
days.
Because after that's too late.
Too late, exactly.
We have a mirror. There's a mirror somewhere, right?
Very nice.
Very nice.
But she's ideal candidate.
Steroid strips just for the first hours because the adrenaline effect goes away. There might be a bit of a oozing and that stops it. Tomorrow, and you can apply makeup tomorrow, can add some foundation tomorrow, no problem whatsoever. Okay? Just have to be careful today not to open your mouth very wide for 1 week. You can smile, but you cannot laugh. Okay? But you also cannot cry.
In a diabetic,
If-
strict control of
Yeah, if the diabetes is controlled. Yes. Actually, I think diabetic patients or patients with autoimmune diseases or patients that are in risk for surgery, they are good candidates for this. With a pencil, okay? If I need to do the eyebrow, relax, relax. It's just a pencil. I just mark the tail of the eyebrow. Okay, this will be my entry point. Okay, so from here I have to decide 2 things. First is an 8-cone thread for sure, nothing more than an 8-cone thread. I usually measure around 4 centimeters. Okay, 4 centimeters in our case is there. I actually can go a little bit further because the supratrochlear notch is there. Okay, so I can go a little bit further. There's a long eyebrow. And this is the placement of exactly under the eyebrow because this will do. And then I have to decide where I want the other vector. More vertical because I'll do this. See that nothing happens. Or more posterior, nothing happens. Or if I have to go a little bit like this. And then in their case, I do something. So if I have to do this, I move the entry point there. Okay, because these will be contracting each other. So I move the entry point there. There are some people who do from here, the opposite. But here is more risky and is more visible and they have less, it's more given to get a pinch. Okay, so you just move there. The thing is you have to decide where you want to move the eyebrow. But first, neurotoxin, please. Okay.
even in a young patient,
Especially in a young patient.
because they're more normal.
Entry point, in our case, will be here. And I move 4 centimeters, exit point. And the exit point on the scalp, I actually going to measure 7. And up there.
Don't sacrifice any.
Because I want to create as much traction as possible. Okay, and some cases, instead of cutting the thread, I give a knot for 5 days so I can hold it in place. Because this tends to bleed a little bit. And if you go with the needle from here to there, it's not the easy one. So master the jawline, the mid-face, then you come here, then you go on the neck. Okay?
Now, can you show us?
Okay? So this will be my line. And then from this point, I mark 9 centimeters, because it's a 12 cone, which is end up over there. And the same thing, 9 centimeters from this point, that will end up more or less here. Okay? So anesthesia there, anesthesia there, the entry points. I get in, all the way I get out back. Get in, all the way, here, 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 and I exit on that point. Okay? So from that side, do the same thing. I usually do the back one, then, and this one I'll cross on top of the other. So in the end, what I'm going to do is this. And then this.
How much distance would you want between the threads here at the midline?
From entry point to exit point, you need 9 centimeters.
Between the two threads which are
Oh, 1 centimeter, half a centimeter. It's okay. But here you need 9 centimeters. If it's a 12, if it's a 16, you need 10 centimeters. So this is what defines how many cones you're going to need. Okay. Thank you very much.
Thank you. I should thank you, sir.